Vaccine rollout continues. Doctors at UW Health are fielding a lot of questions about when you'll get the shots and to protect yourself against the variants.
UW Health's Chief Quality Officer, Dr. Jeff Pothof, joins us now. Hi, Dr. Pothof.
Good to see you.
Good afternoon, guys.
So still some bottlenecks in vaccinations. Last night, Mercy Health reported that they received zero vaccine for the second week in a row. So there's a lot of frustration out there. And how much longer do you think the demand will exceed the supply? Do you have any idea?
You know, I think that's a good question. You know, from the federal government, we have heard that there is this desire to get more vaccine out there and some contracts being signed. But I think, you know, what we're waiting for now is to see those vials arrive in the state. Right now, we're in a situation where we have, you know, far more vaccinators ready to inject people with vaccine than we have vaccine to give. And, you know, we just need to see those numbers get higher. We want to understand that there's barriers, you know, in making vaccine, and that can take some time. But we just need more vaccine in Wisconsin and, quite frankly, around the United States to get this pandemic over with.
It's just very frustrating for people. They have an appointment set up and then it gets canceled.
Yeah, I can understand how frustrating that has got to be for people. I can't imagine. So many people are looking forward to this, and then being told that you're going to have to reschedule because there's not enough vaccine has really got to be disappointing for them.
And for the rest of us who don't fall in the first two groups, do you think it's going to be several months before everyone gets access to the vaccine?
I think it's hard to know. So, you know, we have Johnson & Johnson getting emergency use authorization. That could create additional vaccine supply. We have heard that there are additional doses of Moderna and Pfizer coming. And if we get these huge boluses of doses and we maintain this infrastructure that allows us to get it, it's possible we could play catch up very quickly. If the current trend continues, yes, I think it would be unlikely that we would have large numbers of the population vaccinated before the end of summer.
We hear about all these new strains of the virus, the variants. Will the vaccines work against them?
You know, it's looking promising so far. Certainly for the UK or the B.1.1.7 strain, it does appear that all the vaccines out there at least prevent severe disease. And even looking at the other variants, the Brazilian and the South African, not as common in the United States, they may not prevent as much mild disease, but it does look like they're still effective against severe disease, which is what really counts.
We're always learning more every single day, and we're getting interesting questions. Someone asked us if you should avoid acetaminophen and ibuprofen after you get your vaccination.
Yeah, so the answer to this, unless there's another reason that you would avoid acetaminophen and ibuprofen that you've talked to your doctor about, we would highly recommend using acetaminophen and ibuprofen for the side effects of the vaccine. In fact, it's very effective in controlling, you know, those headaches, those muscle aches, things like that. So if taken by the label on the bottle, go ahead, take ibuprofen or acetaminophen after you get your vaccine if you're having any symptoms.
Let's talk about vaccine hesitancies. That study shows that a third of the public will fall into the wait and see category. Is that okay?
You know, it poses some challenges. So if a lot of the population goes into the wait and see category, we start to struggle in creating herd immunity. That's kind of like the trouble for the greater population. But I also worry about those people who are in that wait and see category because they may wait so long that they actually get COVID. And now they're taking their chances, you know, with severe disease, hospitalization, even death. And we know the vaccines are safe and they're nearly 100% effective in preventing severe disease. So it really doesn't seem like you have too much to lose by getting the vaccine at this point.
Well, vaccinations are ramping up and hospitalizations and deaths, thankfully, are down. So, I mean, is there a case to be made for some optimism?
Yeah, you know, there's a lot to be optimistic about right now. Our cases are down, our hospitalizations are down, you know, our hospitals are able to take a breather. We have vaccine available and supply is ramping up. You know, the light at the end of the tunnel only looks brighter every single day. So a lot to be optimistic about. But at the same time, don't let your guard down. We still need to do our social distancing, our masking for a little bit longer.
All right. Dr. Pothof, thanks for being with us again. Again, always good information.
Thank you.
Thank you, Dr. Pothof. Great to see you.